Welcome back to Healthy Lifestyle with Saira. In today's video, we will discuss in detail about endometriosis and its treatment options. First of all, we need to know what is endometriosis. Endometriosis is a condition where tissues similar to the lining of your uterus grows on the other parts of your body. When this tissue grows in the wrong place, it can cause you to experience uncomfortable symptoms that can impact your daily life. Some people with endometriosis also have issues getting pregnant. The endometriosis is the lining of your uterus. This tissue is what you shed during a menstrual period. A few places you can develop endometriosis include outside and back of your uterus, fallopian tubes, ovaries, vagina, peritoneum, bladder and uterus, intestines, rectum, and diaphragm, which is a muscle near the bottom of your chest that plays an important role in breathing. Symptoms of endometriosis. Common symptoms of endometriosis include painful periods. Pelvic pain and cramping may start before a menstrual period and last for days into it. You may also have lower back and stomach pain. Pain with sex. Pain during or after sex is common with endometriosis. Pain with bowel movements or urination. You are most likely to have these symptoms before and during a menstrual period. Excessive bleeding. Sometimes you may have heavy menstrual periods or bleeding between periods. Infertility. For some people, endometriosis is first found during tests for infertility treatment. Other symptoms: you may have fatigue, diarrhea, constipation, bloating, or nausea. These symptoms are more common before or during menstrual period. Who can get endometriosis? Endometriosis is a condition that most commonly impacts people between the ages of 25 and 40. It can also happen to younger people during their teenage years. Although many people find relief from endometriosis symptoms after menopause, it can still cause discomfort and pain. Risk factors of endometriosis. Some things can raise your risk for endometriosis. You are most likely to get it if you have a close relative, for example, your parent, sibling, or aunt with endometriosis, have a low BMI, have short menstrual cycle, a gap of less than 28 days between the start of one period and the next, have heavy periods that last more than a week, were very young when you got your first period, went through menopause at an older age, have never given birth, have high estrogen level, have a health condition that stops blood from flowing normally during your period. Treatments for endometriosis. There is no cure for endometriosis. Treatments usually include surgery or medications. Some possible treatments of endometriosis include pain medicines. Your doctor may recommend an over-the-counter pain reliever. Non-steroidal anti-inflammatory drugs such as ibuprofen or naproxen work for many people. If these don't ease your pain, ask about other options. Hormones. Hormonal therapy lowers the amount of estrogen your body makes and can stop your period. This helps lesion bleed less so you don't have as much inflammation, scarring, and cyst formation. Common hormones include Common hormones include birth control pills, patches, and vaginal rings. Gonadotropin releasing hormones, agonists and antagonists, and danazol. Surgery. Your doctor might recommend surgery to take out as much of the affected tissue as possible. In some cases, surgery helps ease symptoms and can make you more likely to get pregnant. Your doctor might use a laparoscope or do a standard surgery that uses large cuts. Sometimes pain comes back after surgery. In most severe cases, you may need a surgery called hysterectomy to take out your ovaries, uterus, and cervix. But without them, you can't get pregnant later. Home remedies for endometriosis pain. There are some home remedies that help to reduce the pain and other symptoms of endometriosis. Number one is heat. Taking a warm bath or placing a heating pad or hot water bottle on the lower abdomen can help relax cramping pelvic muscles and reduce pain. This is common remedy for menstrual cramps that may offer immediate relief for some people with endometriosis. Pelvic massage. Pelvic massage may ease endometriosis related pain. Manipulation of pelvis and lower back may increase blood flow to the area, relaxing it and reducing pain associated with scar tissue from this condition. Dietary changes. Altering the diet may reduce endometriosis symptoms. Minimizing the consumption of red meat and increasing the intake of fruits, vegetables, and whole grains can help improve overall health. This is all about endometriosis. Hope you enjoyed this video. If you like my video, please subscribe my channel. And for any health related question and query, you can ask in the comment section below. Goodbye.